my name is Rochelle Balangitan. For my nursing informatics class video, I will introduce what pneumonia is, the signs and symptoms of pneumonia, and I will provide a demonstration on preventative and treatment care for pneumonia. First off, let's discuss what is pneumonia. Pneumonia is an infection of the lungs, which is normally caused by bacterial infections. The infection inflames the air sacs of one or both lungs, and the air sacs may be filled with fluid or pus. Pneumonia seriousness can range from mild to life-threatening. It is most serious in infants and young children, and for people who are older than 65 or who are immunocompromised. Now that I've discussed what pneumonia is, let's talk about the signs and symptoms of pneumonia. People with pneumonia may develop shortness of breath, fever that are mild or high, productive cough that are sticky, greenish, or yellow mucus, fatigue or muscle aches, nausea, vomiting, diarrhea, and even headaches. Those are the different kinds of symptoms that they may develop. Now let's go ahead and demonstrate on preventative and treatment care for pneumonia. First off, what are the most important medical devices that you can use for people that had a surgery of their chest or abdomen, or for people that have a serious illness such as pneumonia, is to use an spirometer. A spirometer is a medical device that they can use to help expand their lungs. It helps with respiratory fitness and helps with any complications that you may have. So first I'm going to go ahead and show what the spirometer is. And this is an spirometer. Normally after your surgery, you may use this to help you expand your lungs because it's harder for you to breathe normal when you have an incision. It may be difficult because it's painful. So what I'm going to do is have someone demonstrate on how to use this. There you go. Okay. When using an spirometer, the best position is to sit on the edge of your bed if possible, or sit up as far as you can in bed or chair. Do not bend your head backward or forward. Hold the spirometer in an upright position. Place the mouthpiece in your mouth and seal your lips tightly around it. Breathe out normally and inhale slowly and as deeply as possible. You'll notice the yellow piston rising towards the top of the column. The yellow indicator should reach the blue outline area. If you breathe in too fast, the ball will shoot to the top. If you breathe in too slowly, the ball will stay at the bottom. Hold your breath long enough to keep the balls or discs raised for at least 5 seconds. Then exhale slowly and allow the piston to fall to the bottom of the column. Rest for a few seconds and repeat these steps at least 10 times every hour. Position the yellow indicator on the left side of the spirometer to show your best effort. Use the indicator as a goal to work toward each slow, deep breath. After each set of 10 deep breaths, we encourage you to cough to clear any secretions you may have. Once you are able to get out of bed safely, take frequent walks and practice the cough. Repeat these steps 10 to 12 times every hour when you are awake or as often as directed. Remember, if you start to feel dizzy or lightheaded, remove the mouthpiece from your mouth and take some normal deep breaths. Then continue using the spirometer. You also want to keep a log of the highest level you're able to reach each time. This will help your caregivers monitor your lung function. To keep your mouthpiece clean, wash with soap and water after each use. Do not use disposable mouthpiece for any longer than 24 hours. If you have an incision on your chest or abdomen, it may be difficult for you to cough. You can support your incision by using the splitting technique. Support your incision by holding a pillow firmly against your incision. This will help provide support and decrease pain you may feel when you cough. You can do this when you're sitting upright or standing position. Cover your mouth with your elbow and hold the pillow with the other hand when you're coughing. There's also several methods that you can help loosen up the sticky mucus that may make you feel like you're choking. Breathing warm, moist air helps loosen sticky mucus. You can place a warm, wet washcloth loosely over your nose and mouth. You can also fill a humidifier with warm water and breathe in the warm mist. Take a couple of deep breaths 2 or 3 times every hour. Deep breaths will help open up your lungs. Tap your chest gently a few times a day while lying with your head lower than your chest. This helps bring up mucus from the lungs so that you can cough it out. Lastly, practice good hygiene. Always wash your hands, drink plenty of fluid unless restricted by your physician, and get plenty of rest. You also want to make sure that you take your antibiotics and do not miss any dose. You want to go ahead and make sure that you complete the whole entire course of treatment. One of the most important ways to also prevent pneumonia is to get your flu or pneumonia vaccination. Okay, and this is Rochelle, and I hope you learned something from my video. Thank you.